Telehealth has made healthcare more accessible over the years, but it hasn't been without its challenges.
Now there's a company who is advancing the practice of medicine with an improved telehealth experience, and Nima Mowzoon, CEO of UBI Telehealth, joins us now. Good morning.
Good morning. Thank you very much for having me.
Yeah, it's wonderful to have you in. So what is UBI Telehealth, and what was really the driving force behind creating it?
So we've been in the business of telehealth at Telespecialists, the company that we started about 11 years ago, bringing telehealth to hospitals. So we started out seeing patients that are coming in at the critical time of need with stroke. And we've treated so far 1.5 million patients all this time. But every single time that we see a patient that is suffering from a stroke, you know, every single time, we're glad we're there at the moment of need, but then afterwards we think, what could medical care have done better to save that patient? How could we have prevented that from happening? And what is really our model of healthcare to begin with? Right now, our model of healthcare is focused on how can we put the fires out? How can you treat disease? But how about if we treat patients? How about if we bring them wellness and preventative care? So the whole idea of UBI Telehealth came out as a result of that. How can we bring healthcare to consumers at the comfort of their home to really bring them wellness and preventative care?
Yeah. So you mentioned, you know, the setup being part of dealing with strokes and helping stroke victims. Who is the UBI Telehealth for, though? Does it, like you mentioned, you know, preventative-wise, is it for everyone? Are there certain people that should sign up for this?
Exactly. So it's for everyone who can potentially be at a risk of cardiovascular risk, heart attacks and stroke, and other things like that. It all really starts from our diet and our lifestyle and what we do with our bodies, and that's where it starts. Over years and years and years, we don't treat our body the right way, and then when it comes to stroke and heart attack, then you're dealing with advanced disease at that point.
Right.
Yeah. How is UBI Telehealth currently really making an impact and a difference in people's lives?
Well, you know, we are basically able to give patients the platform to basically take their phone at the comfort of their home, go on the phone and actually be able to talk to a physician who's licensed in their state and talk about how they can get well, how they can prevent disease. And a big part of that is weight management and lifestyle modification.
Yeah. What's the great differentiator between you and the other competition out there for the telehealth platform that you offer? Well,
you know, the most important thing is that we really understand how to do telehealth. We are physician-run, we're physician-owned, we're all physicians. We have about 200 physicians in our company. We're the largest firm out there that does telemedicine. So we've been in this business for a very long time. And now seeing the other side of it and seeing the sickness side of it, we are here to really do wellness.
Yeah, and you know, as an MD, you really spend significant time in the medical field. So do you have any feedback from even patients having used UBI and the differences they've experienced in that?
We actually, since we're in communication with our patients pretty much on a daily basis, the feedback that we get overwhelmingly is positive. The fact that they can reach out to us and talk to us at a moment's notice and actually get a physician at a moment's notice at the comfort of their home really makes a very big difference. Patients aren't able to do that now. They can't talk to their physicians very easily.
Are there any popular myths or frequent questions you get asked about telehealth in general that are easily dismissed as, you know, people like, oh, it's too difficult, or it's too expensive, or I don't know if I'm speaking to a real person? You know, are there any common questions that you come up against?
All of the above. I don't know if I'm talking to a real person, but now here they are. We are a real person. They show you, they see us on the video. You know, we make a good rapport with the patients from the very beginning. How expensive is this? When they actually start the journey, they actually really realize it's much cheaper than conventional care.
Right. And you don't have to schedule or drive to an appointment, park and get out and see a doctor.
Yes, it's at the moment's notice, at their fingertips.
Right.
Yeah, Dr. Mowzoon, you actually came today as well with a special offer for our viewers watching. What is that?
Welcome to any. You can actually go on ubitelehealth.com and answer some simple questions for the service that you're looking for. Then you get to talk to a physician and you use the code, and the code gives you the $20 off from your purchase. That's very easy.
Nima, thanks so much for coming in today. Great talking with you. Guys, for more information on Nima and to learn more about UBI Telehealth, just visit ubitelehealth.com.
And remember, use code WELCOME20 at checkout and get $20 off your first order.